Eye Swab Culture Test, detailed explanation. 1. Introduction. The human eye is constantly exposed to the external environment, making it vulnerable to infections caused by bacteria, viruses, fungi, and parasites. These infections can lead to conditions such as conjunctivitis, keratitis, blepharitis, and corneal ulcers. Clinical features like redness, discharge, irritation, or blurred vision may overlap between infectious and non-infectious causes. Therefore, laboratory confirmation is often necessary to identify the exact causative organism. The Eye Swab Culture Test is a simple, reliable, and widely used diagnostic tool that helps in identifying the microorganisms responsible for eye infections and provides information about their antimicrobial sensitivity. Definition. The Eye Swab Culture Test is a microbiological diagnostic procedure in which a sample of discharge, exudate, or tissue from the eye is collected using a sterile cotton swab. This specimen is then cultured on selective media to promote the growth of microorganisms, bacteria, fungi, or viruses. Once grown, the organisms are identified and tested for antibiotic or antifungal susceptibility, guiding specific treatment. 9.3. Indications. The test is ordered in the following situations: persistent or chronic conjunctivitis not improving with standard treatment, keratitis, inflammation of the cornea, corneal ulcers suspected to be infectious, post-surgical eye infections, e.g. after cataract surgery, corneal graft, eye trauma with suspected infection, foreign body, chemical injury, contact lens-related infection, neonatal conjunctivitis, ophthalmia neonatorum, recurrent red eye or discharge of unknown cause, suspected drug-resistant infection. Used for identifying bacteria, fungi, or viruses causing eye infection, determining antibiotic antifungal susceptibility, sensitivity pattern, differentiating infectious versus allergic or chemical causes of red eye, monitoring hospital-acquired infections in eye care units, supporting public health investigations during outbreaks. #5. Why do need of this test? To establish a definitive diagnosis when clinical findings are inconclusive, to avoid empirical use of antibiotics and ensure targeted therapy, to detect drug-resistant organisms such as MRSA, Pseudomonas, or multi-drug-resistant fungi, to prevent serious complications such as corneal perforation, endophthalmitis, or permanent blindness, to monitor patients with recurrent or non-healing infections. 6. What happens during the test? Step-by-step process. 1. Preparation. The patient is seated comfortably, and the procedure is explained. No anesthesia is usually needed unless corneal scraping is performed. 2. Collection of sample. A sterile swab is gently rubbed over the conjunctiva, eyelid margin, or area of discharge. For corneal ulcers, a sterile spatula or blade may be used to scrape the ulcer after instilling a local anesthetic. 3. Sample handling. The swab is placed in a transport medium to preserve organisms. Samples are immediately sent to the laboratory to prevent contamination or drying. 4. Laboratory processing. Direct microscopy, gram stain, Giemsa stain, KOH mount for rapid results. Culture on selective media. Blood agar, chocolate agar, bacteria. Saborod's agar, fungi. Viral transport medium, PCR or culture. Antibiotic susceptibility testing is performed if bacterial growth is detected. 7. How long for my results? Preliminary microscopy results within 24 to 48 hours. Bacterial culture results 2-3 days. Fungal culture results 5 to 7 days, sometimes up to 3 weeks. Viral PCR results 1 to 3 days. Antibiotic susceptibility report additional 1 to 2 days after organism growth. 8. Prepare for this test. Usually no fasting or special preparation required. Avoid eye drops, ointments, or antibiotics at least 6 to 12 hours before the test, unless told otherwise. Inform the doctor if you use contact lenses, are on antibiotics or steroids, have had recent eye surgery or trauma. 9. Risks. The test is generally safe, but minor risks include mild irritation or watering after swab collection, minimal pain or discomfort during corneal scraping. Rarely, minor corneal abrasion heals quickly. No risk of infection transmission since sterile instruments are used. 10. Normal values. Negative culture, no growth of pathogenic organisms. Presence of normal ocular flora, commensals such as Staphylococcus epidermidis, Corynebacterium species, is considered normal and not clinically significant. 11. Interpretation of results. Positive result. Identifies specific bacteria, fungi, or viruses. Sensitivity testing shows which drugs are effective. Negative result. May indicate non-infectious cause, e.g. allergic conjunctivitis. May occur due to prior antibiotic use or poor sample collection. Mixed growth may suggest contamination or multiple infections. 12. Factors affecting results. Prior use of antibiotics, antifungals, suppresses organism growth. Poor sample collection, insufficient organisms, delay in transporting sample, organism death, improper storage, false negatives, contamination from skin or environment, false positives. 13. Clinical significance. Provides definitive identification of the infecting organism, guides appropriate treatment with correct antibiotic, antifungal, prevents vision-threatening complications, helps in monitoring antimicrobial resistance trends, essential in immunocompromised patients, HIV, transplant recipients, chemotherapy patients, where unusual organisms may cause infections. 14. No more. Special diagnostic aids used with eye swab culture, gram stain bacteria, KOH mount fungi, Giemsa stain, viral inclusion bodies, parasites, chlamydia trachomatis, PCR, polymerase chain reaction, highly sensitive for viruses, herpes simplex, adenovirus. Contact lens wearers are at higher risk of Pseudomonas keratitis, which can be life-threatening to the cornea. Hospital outbreaks of eye infections, e.g. neonatal conjunctivitis, postoperative endophthalmitis, are often traced using culture tests. 15. Conclusion. The Eye Swab Culture Test is a vital diagnostic tool in ophthalmology and infectious disease management. It helps detect the exact organism causing an eye infection, allows targeted therapy, prevents overuse of broad-spectrum antibiotics, and minimizes the risk of permanent eye damage. With accurate sample collection and timely laboratory analysis, most eye infections can be successfully treated, ensuring preservation of vision and eye health. Thank you. Have a nice day.